All right. Hello, everybody, and welcome to ARH4, Programs within a System Focused on Ending Chronic Homelessness. My name is Victoria Boyle, and I am your moderator for this session. So today we have three incredible presentations, which will be followed by a Q&A session. So we ask that you hold all of your questions until our Q&A session at the end. And without further ado, first up, we have John from MAP and Sarah and Margot from LOFT.
Hi everyone, thanks for coming out today. So I'm John Ecker, pronouns he, him, and I'm a research manager and adjunct scientist at MAP, Center for Urban Health Solutions at St. Mike's Hospital in Toronto. And I have with me, Sarah, do you want to introduce yourself?
I'm Sarah Collins, Associate Director of Mental Health and Homeless Services at LOFT Community Services. Pronouns she, her.
Hi everyone, I'm Margot. I'm the program manager for the match team and my pronouns are she, her.
Perfect, thank you. So yeah, today we're going to be talking about Beyond Housing. We're just going to start with a really brief overview of what Beyond Housing is, and we'll explain more details throughout the presentation. But to kick us off, so Beyond Housing is a 3 to 4 year pilot project that aimed to support people experiencing chronic homelessness in Toronto's low barrier shelters. The goal is to think beyond housing to, it's in the name obviously, to support people's health, social, and community needs. And just a bit of context, as with most communities across Canada, chronic homelessness is at really an unprecedented level in Toronto. As of August 2024, 75% of shelter users in Toronto meet chronic homelessness definitions. This is a 20% increase from 2022 when we first started this project, so we've really had to pivot a lot, and we will discuss that more as we move forward. So Beyond Housing has 4 main partners. We have the Toronto Alliance to End Homelessness, who is supporting service coordination efforts through case conferencing. We have Dixon Hall, and I see some Dixon Hall folks in the room. Woo, thank you. Which is our primary recruitment site, so the operators of the shelter. And then we have LOFT Community Services, who are our case management providers, and then MAP, who I represent as the kind of project coordinator and funder. So I'm just going to go over like who MAP is, and then Sarah and Margot will go into who LOFT is. So MAP, it isn't an acronym. I think that's the first question I get all the time. We're a world-leading research center dedicated to creating a healthier future for all. Based at a St. Mike's Hospital, downtown Toronto, part of Unity Health Toronto. Through big picture research and street-level solutions, MAP scientists tackle complex community health issues, with homelessness being one of them. We work with community and policy partners. We chart ways to the world's healthiest cities, places where people, communities, and the political, economic, social, environmental, and health infrastructures come together so that everyone can thrive. So that's a bit about MAP, but now we'll hear more about LOFT.
All right. So LOFT Community Services has been around since 1953, offering dignity and hope to people living with mental health, physical health, substance use, and those who are homeless. We're a leader in holistic, complex mental health care in response to unmet and emerging needs. We truly believe that things can improve and that recovery is possible. We're one of the largest community services providers in Ontario, specializing in complex combinations of mental health and addictions, poverty, and supportive housing. We work with people who have the most complex needs, and working with our partners, we're proactive in addressing community challenges, reaching out to people who often fall through the cracks. So I just wanted to touch on some of our mental health and homeless services specifically. We have 3 main programs that work out of our Front Street hub in the City of Toronto. Because we work with the same populations and across the same teams as well, we work very closely and collaboratively to help clients as they transition through different systems. So just to speak about the CATCH program, which is Coordinated Access to Care from Hospital, that's a partnership program created in 2010 with mental health case managers and access to a clinic that provides nursing, physical health care, doctor, and psychiatry. So individuals that come into hospital emergency rooms or inpatient units, they're referred to our program connected to a case manager, and the case manager works with the discharge planning team to support transitions out of the hospital, and then continues to work with individuals in the community to help get connected to healthcare supports. MDOT, the Multidisciplinary Outreach Team, is an outreach team that was created in 2006 as a partnership with the City of Toronto to provide a higher level of outreach and care for individuals experiencing mental health. So we have case managers, mobile psychiatry and nursing, and peer support that go into the community and connect with individuals. So both of these programs are transitional programs that can directly refer into our MATCH program, and MATCH is the program that's working with Beyond Housing, so I'll speak a little bit more about that. And the aim of these programs is to create access points for individuals through whatever systems they may be connecting with, so hospital, TTC systems, drop-ins, shelters, and on the streets. So as mentioned, CATCH and MDOT are both transitional programs. We found that folks were often getting lost during transition and returning to our programs as they needed that intensive level of support. Individuals were transferred to other programs for longer term supports, but we found that they continued to come back to us to receive supports, even though we were providing warm handovers. They just didn't feel like their needs were being met at the same level in which they needed. So in 2015, we created the MATCH program, Multidisciplinary Access to Care and Housing. And we learned that, those transitions are hard, and we needed to create a consistent way for individuals to continue to receive access to psychiatry, nursing, peer support, and case management that they had built trust and relationships with. So since its inception, MATCH has grown. The At-Home Chez Soi project was a program that was started in 2009, and they're individuals, case managers working with individuals from a housing first model and providing that mental health case management. That program's been around for a little while, so most individuals, a high number of individuals, are stabilized in their housing and don't need that intensive level of case management. So during COVID, as homeless numbers were more visible, we merged the two programs together to increase capacity so we could really provide some intensive case management to individuals experiencing homelessness. The second growth for MATCH was also during COVID. It's the 877 Young project. With our partners at St. Clair's Multi-Faith. They have a building in Toronto where individuals who are experiencing chronic homelessness are housed. We go in and provide embedded case management supports and peer supports to support those individuals to be successful in their housing. And then we have the Beyond Housing project. So just to reiterate, the goal of MATCH is to support improved transitions. We found that when clients were moving into housing, again, they were already dealing with so much that changing their support systems also created a challenge. This model allows for the same team to work with identified individuals to reduce that added stress. And we found that transitioning within the same partners or agency allowed for ongoing communication between transitional case management teams and long-term case management teams, which increased trust and consistency. So just as an example, the nurse on the MDOT team also works on the MATCH team. So, we can provide that continuity of care and help create a constant bridge. So the objectives of the Beyond Housing program is to improve access, reduce wait list times to service, increase the number of clients receiving appropriate levels of care, reduce ED visits, connect clients to appropriate services that meet their needs, and to provide extended hours. Eligibility criteria for these programs is individuals experiencing serious mental health challenges, experiencing homelessness, often deemed to be chronic homelessness, possible substance use challenges, and possible cognitive impairment and or acute or chronic medical illness, and those that are not attached to other ACT teams or long-term case management, and the majority of our clients often fit into all or most of these boxes. Oh, or me. Okay, so when a referral is made to the MATCH program, it's assessed by the team to identify some of the individual needs that the individual might have. The referral is matched with a case manager based on those needs. Contact with the referral point is made within 1 week, often sooner. The initial meeting with the client, referrer and case manager happens. Second visit is scheduled to work on an intake, and then just the important part of the ongoing communication to work as a team to support folks.
Sarah. So if you've seen a presentation by me, I'm not saying you have, but I just love this meme. It's when Mariah Carey is asked by an interviewer if she knows J-Lo, and she says, I don't know her. So I thought it was fitting, okay, like, so what is Beyond Housing, right? We tell you all this stuff. Beyond Housing is a 3-part pilot, as I said. The first piece is access to long-term open-ended case management through the MATCH team. We've also partnered with LOFT Community Services to offer mental health supports through a mental health counselor to provide group-based programming in the shelter and one-on-one support for people as they move into the community. And last, we also had care conferencing, which you spoke about last year at this conference, actually. Oh, the down button, down. I'll just go here.
Fancy transitions.
So this project didn't come on its own. We did collaborate, obviously, with our partners to identify what to do to really address these systemic barriers people experiencing chronic homelessness are facing. So we heard that some low barrier shelter residents who are prioritized for housing through coordinated access don't engage with supports available at the shelters. So how do we think about increasing engagement? We also heard that there's few opportunities for staff to come together to share their knowledge about residents. And, we're kind of getting an incomplete picture of a lot of client needs. So putting the coordination and coordinated access. Shelter residents are at different stages of housing preparedness. So some are administratively ready. Some may feel like they're not ready to move into housing. So we really try to think about adding extra supports besides permanent housing that is offered through coordinated access. As shelter residents move into the community, some will have challenges with attending appointments, so offering that case management support is really key, and also wanting to address social isolation and boredom too. So this is a systems-based kind of model approach, and we really wanted to, see how this could fit within existing systems. So Beyond Housing really is meant to fit within kind of a housing first philosophy, but also a coordinated access service system. So I won't go into detail to the slide by any means. It's a bit, it's a lot, I understand that, but really trying to just demonstrate how we're trying to fit interventions within this broader kind of coordinated access system. So yeah, I'll get that to Margot.
Yeah, so I'm going to talk about challenges. So some of the challenges of the coordinated access program with how we're implementing that through MATCH is, so again, as John had mentioned, some residents who are prioritized for housing through the coordinated access do not want to engage with supports that are available at the shelter. They may not be housing ready administratively, but they also have complex needs. Sorry. At Beyond Housing, we are addressing these challenges by providing quick access to our program within the shelter, which leads to assessments getting completed faster. We can coordinate prioritization with the shelter staff and have better understanding of specific needs, specific client needs, and while we're looking for and matching clients with suitable housing. So as this program was being developed, some of the things that we had planned for instance, having to start our case management at the point of housing, which is what Match typically does, we realized that we needed to pivot that. We needed to go back and take a look at what the need is and where we should be starting at. So we were realizing that the housing readiness piece was a big part, and it can be really challenging starting from the point of housing without having all of the other pieces in place. So the benefit to this approach is having case managers who aren't tied to the shelter. We can go out into the community. We can meet people in the if they're sleeping on the street, if they're sleeping rough, we can follow people while they're in hospital. We can follow people while they're moving around from shelter to shelter, so they have that continuity of care. And then again, once they're ready and we can get them stabilized in housing, we follow them in the community long term. Since we're all working with the same clients within the shelter system, this partnership model is really required to make this system function well. The continuity of care and having the benefit of small caseloads as well, it really helps to dedicate time for that relationship building between clients and staff. So we have a wraparound approach. It's really beneficial when supporting clients with complex needs and relationship building with staff. It creates stronger partnerships, which strengthens communication. A team-based approach also really helps clients meeting client goals and resolving them at a quicker pace. Clients want a consistent team. They like consistency. They don't want to have to retell their story. It can be re-traumatizing. So they appreciate the ongoing or open-ended case management model. So some of the things that have impacted the implementation within the shelter system is, the buy-in can be difficult. So, thinking about staff in the shelter, we're walking into their space, we're walking into their environment. And there's a real push to get people housed from the shelter. And we realize, we can't rush things. We need to engage with staff around the current challenges that they're having and have them be part of the implementation of our program. And what do they want to see in their space? How can we work with them together and include them in the long-term plans to see this program through? We also need to have really clear messaging about the purpose of our work and have those roles defined. Relationship building with clients and staff can take a real time and effort. None of this work happens overnight. We have to understand this client base who can typically not want to engage with us. We often need to wait for that window of opportunity when people are feeling motivated. They have a bit of hope. They have a moment where they're ready to step into the next phase. So we have that flexibility with clients. We can take our time. And shelter staff have multiple competing priorities, and we have that flexibility. So some more impacts on implementation. So mechanisms to be kept in the loop is really about the communication piece. So we don't have, we're an external case management agency. We don't have access to the same kinds of systems that they do for, client databases. So we needed to create internal systems. We needed to create the referral form and then recreate the referral form and adjust the referral form so that we're getting all that information that we need. And then having partnership huddles and really communicating with the shelter staff about what individual client needs and tailoring our case management to that. So another big barrier, as we all know, is housing. It's very hard to come by, and sometimes client expectations can be high. We've learned how to try to manage that and the realities of housing at the moment. And as we've mentioned multiple times already, not all clients want to engage. Some clients have trouble engaging, whether it's time management issues. We need to take time to build that rapport. And sometimes we just never get there with people. So in summary, by streamlining the referral process and having strong partnerships, we could move clients into housing from shelter and keep them stabilized in the community, preventing them from landing back in the shelter system. We can't end homelessness in silos. We need to be working together to tackle it, and by using the principles we know from the Housing First philosophy, creating an environment that facilitates recovery and multi-level coordination and partnerships, we can move closer to seeing the end of homelessness in Canada together. Yay! Yay! Thank you.
All right, thank you so much for that presentation. And now we will hear from Michael from Flourish.
Let's see how ambient this microphone is because I'm tall. Let's see. Yeah, I think that's going to work. Great. Thanks, everyone. I wanted to just start off by thanking CAEH for putting together this event, for taking the time to recognize the work of the organizations that are represented here, that we're doing, a lot of the unspoken work, unseen work that I know a lot of people in this room do every day. And I also really want to thank you all for coming to this session, for being curious. I hope that you've come with a sense of openness and interest in really taking action and really moving towards practical steps and solutions. So thank you for coming. So I'll talk a little bit about Flourish and who we are, about myself. I don't want to spend too much time talking about who we are. I'd rather talk a little bit more about what we're doing, and I hope that that can provide inspiration for some of you. I'm going to speak in pretty broad strokes about some of our work, about some of the potential solutions we're seeing, and I hope that you can pull something from that that's relevant to you in your context. So Flourish was born out of a need to develop and construct supportive and affordable housing, and we'll talk a lot more about that. Some of you will be familiar with Indwell. Indwell is a Christian charity that was founded in Hamilton 50 years ago and now operates throughout Ontario. Indwell is a charity that provides supportive housing, mental health and wraparound health supports integrated into housing. And about 15 years ago, they recognized that they couldn't continue to keep growing at the pace they needed to if they didn't actually start adding to the housing stock. There just wasn't enough out there. So they started recognizing this problem quite a while ago. And so what they did is they formed a small team of ambitious folks who said, yeah, we can build a building. I think we can do that. And with the implementation of the National Housing Strategy in 2017, the federal funding that flowed through that, they were able to really move and start developing supportive housing for Indwell. They had a lot of success. They were fortunate. They gained a lot of experience, a lot of learning. And because of that, they were able to add about 500 units of supportive housing throughout Ontario, permanent supportive housing. Of course, by this point, Indwell is getting recognized by other municipalities, not-for-profit groups who are saying, like, hey, can you come build a building in our city? As a charity, they decided for many reasons that it would be best to take that development team and create a new organization that exclusively did development as a not-for-profit and development consulting. And so Flourish was born. And that's what we do. We provide consulting on how to actually take an idea that is, we need permanent, supportive, and affordable housing built in our community and turn it into a reality all the way from that ideation stage to construction and opening the doors. And that's what we do. We do it for Indwell, but we also do it for other folks. We work with municipalities. We work with other not-for-profits. Some of you will be familiar with Victoria Park Community Homes and other folks as well. Sacagawea Housing in Hamilton as well is another one of the folks that we work with. So that's what we do. And I've been with Flourish for a couple of years. working to help them. I'm a Hamilton native. I've lived there for 15 years with my two toddlers, and we like ice cream. I passed that on. So in broad strokes, I'm going to talk about some of the problems that we're facing. I'm going to identify some of the solutions that we've seen. I'm going to lead us through some examples of some of the work we've done where we've been able to implement those solutions. And then most importantly, I want to talk about some action steps. And again, I'm going to be talking in broad strokes. We don't have a ton of time. But I want to make sure that you can go home with something, some inspiration for yourselves. So, problems. So, I don't think that I need to say to this group that that the big problem is that there is a housing problem, a housing crisis, really. And I'm told, and I double-checked my app, and this is an intermediate level seminar. It's more of a blue square than a green circle. So we're going to kind of go deeper into the problems and get beyond that housing is a problem. Let's talk about some of the factors that are exacerbating that problem. Number one, the lack of permanent solutions. So this is a really big challenge. We need, as I'm sure many of you know, we need a whole range of tools, a spectrum of housing solutions to address this crisis. It's often convenient, especially for political leaders, to target one solution or one problem, but we know that this is actually complex. This is multifaceted. We need multiple solutions for a complex problem. But one of the key solutions is permanent housing, and we need permanent solutions. Another challenge is underutilized municipal assets. So this is a little bit more specific. I have a picture up there of a parking lot. One of our clients, a municipality, has owned this parking lot for a long time. As you can see, it's not very busy, and it's sitting there. This is a rural municipality. This isn't a downtown core. This is a municipal asset that could so easily become permanent housing. And then, of course, compounding market pressures. Again, the list could go on. This will sound so familiar to all of you. Whether it's rent evictions, rent increases, housing costs going up, construction costs increasing, that's a huge, huge issue that leads to not nearly enough housing starts. And critically, not nearly enough non-market housing starts. 3% of the housing starts in Canada are non-market. That's not enough. Of course, inflation. In Hamilton, family income needs to be over $100,000 to be able to respond to what the market has to offer in terms of housing. It's just not acceptable. In 2013, as I was reminded in an earlier presentation, the average one-bedroom rental cost in Ontario was $900 a month. In 2023, that's $1,500 a month. It's a 45% increase, if my math is correct. And sadly, ODSP has not increased by 45% in the last 12 years. So, let's talk about some solutions. And by the way, these are all pictures of supportive housing projects that we've helped develop and consult on the construction of. These ones are an Indwell building in the North End in Hamilton. So, as I mentioned, we must build non-market housing. And this presentation is focused on supportive housing. And I hope you've been able to attend some sessions and hear a little bit more about supportive housing. If you talk to my colleagues and partners at Indwell, they'll tell you lots and much more informatively about supportive housing than I can. But we also need mixed affordable. The way that CMHC has set up their funding programs now, in some cases, advantages mixed affordable development. So this means where a portion of the units are at market and a portion are at affordable rates. Again, we need multiple tools to solve a complex problem. And this is really the only permanent solution to homelessness. We need permanent supportive housing. So in Guy's presentation this morning, there was there was a lot of amazing things to pull out, but it really gripped me when he mentioned the woman he spoke to who said, you know, if I had stable housing, I can get sober. You know, housing first is so important. How can you deal with those 90 problems if you don't have secure housing? We know we need permanent housing. So what else? Municipalities need to lead. Municipalities need to lead. In our experience, we found that higher levels of government typically aren't interested in leading in the process of developing and constructing permanent housing. So this is where municipalities, municipal leaders, if you're living in a municipality or a county and you pay taxes, you can influence and say this is where the municipality needs to step up and lead the way. Higher levels of government will follow. This is what we found. And so CMHC, their Affordable Housing Fund, their AHF fund, formerly the COI fund, it needs a co-investor. Municipalities can be that co-investor. They can act as the catalyst to unlocking higher levels of funding. But municipalities can also lead through rapid development through staff cooperation. So we'll talk a little bit more in our examples about the key component that is political cooperation. But how this really manifests itself is in speeding up the development process, specifically the site plan application process. I can contrast very extreme examples of working with different municipalities, where in some cases, the unity and the vision of, yes, like this is a problem, like this is what we need to deal with, leads to quick action, whether it's on parking ratios or how thick the curb is or where the garbage is collected. Versus other cases where sadly that can get really hung up and keep people out in the cold in very real terms. So these are different ways municipalities can really step up and lead. So let's briefly run through some examples of some of the work we've done. I won't go into the pictures there. These are some real live examples of what we've sketched out for different affordable and supportive housing builds in some municipalities we've worked with. Specifically, I'm going to walk through 4 examples of some of the work we've done with clients that have engaged us. Lambton, St. Thomas, Leeds and Grenville, and Halden and Norfolk. So let's start with the County of Lambton. Just to go back here quickly, if you're not familiar, if maybe you're not from Ontario, you can see it's in southwestern Ontario. Sarnia would be the largest city in Lambton if you've heard of Sarnia. So at the end of 2023, they engaged Flourish, and what we did is we put together a portfolio scale affordable housing development strategy. And so what we do is we say, municipal leaders, city staff, you know the ingredients that you have available to you, or the pieces of the puzzle that you have. Give us those ingredients. We'll combine it with what we know of the other local support networks, the other community partners in your region, and how we can use that to leverage higher level of government funding. So we assessed, we looked at 5 municipally owned sites. We deployed our experience in developing supportive housing programs that we've learned from Indwell over the years and different program models, and gave them real construction and development figures to make an informed ask of the higher levels of government for capital and operating funding. In February, so several months later, Lambton Council unanimously endorsed this roadmap and has already engaged several community partners to begin development on some of these 5 sites. So this is really exciting for us. Moving east, closer to where we are today, in the county of Leeds and Grenville, the largest city there would be Brockville. We were engaged early in 2024 to do a similar thing, a portfolio scale assessment of what they have. How can they move practically towards constructing permanent supportive housing? And again, the report that we put together with the practical asks, the real figures that they could use, was unanimously approved by council and endorsed. Their service manager is actually able to take that right to the Premier's office, and they've already begun development on one of those sites. Halden, Norfolk. engaged us a little further down the road. They already had started working out their plan. They had identified a site, and they wanted to build a 35-unit affordable housing build in Dunnville, Ontario, which is southeast, closer to Niagara area. We were able to start working with them on that project. And with our help, we were able to increase the density to 56 units, as well as incorporating a daycare on the ground floor, based off of some of the other community partners we knew would be able to come alongside and engage with that. Now they've moved to a second project with us in Delhi, another part of their combined county. What I want to just pull out from Haldimand Norfolk is something we've seen in the most successful responses from municipalities and communities, and this is the level of cooperation with city staff and political leaders. It is so refreshing working with municipalities and city staff who are united in their vision and their dream and their desire to see housing built. And that's been really helpful in working with them, and something that's easy to say, harder to achieve when you're in it, I know that, but has real practical implications on speeding up the development process. Last example I'll quickly speak about is our work in St. Thomas, specifically with our client Indwell and the work they've been able to do there. I don't know if anyone was able to go to the 10 o'clock session just across the hallway where St. Thomas was really highlighted. So I won't repeat too much. I don't want to repeat too much of what they said, but if you missed it, I don't know about you, I found it very, again, just refreshing. Sometimes at this conference, it's easy to get overwhelmed by the weight of the challenge that we all face and that we face on behalf of other folks. When you hear that they've been able to reduce their chronic homelessness by 30% in 7 months, it's so encouraging. So what can we learn from that? One thing that I know from the work we've done and was so reinforced in that session this morning is the value of partnerships. The value of cooperation with their city staff, with their political leaders, and with the community supports in St. Thomas. And again, just to highlight some of the numbers they shared, 65% of those identified in their 2020 by names list are now permanently housed. Like, that's incredible. That's incredible. St. Thomas came together. They said, this is our #1 priority, not just like, headline, the city says this is a crisis. Like, they actually took it seriously as #1 priority. And they worked with us to develop a multi-year strategy. Where will our first program be? How are we going to fund it to build it? How many staff? Who are we going to put in this building? What acuities? Okay, once that's done, what's the next one that we're starting, so that folks coming out of directly street engaged homelessness, where can they transition out of that building? We don't want them to stay there. We want them to get better. We want them to move to a lower acuity building. Where is that going to be? Okay, and then after that, what's going to be, a more standards acuity support building? A multi-year, thoughtful approach with real numbers to take to higher levels of government to say, we need your support as well. So again, a lot of leadership at the municipal level that really spurred on our leaders at higher levels of government to come alongside and partner. And that's been really encouraging to watch those developments. So what are some action steps? Ending homelessness is possible, so make it a priority. Like St. Thomas, make it a priority. If you work in a municipality, if you're on city staff, make it a priority. Work with a development partner like Flourish or others, CADCO. I know there's some other organizations across other provinces who I'm not as familiar with. Find out who your affordable and supportive housing development partners are. Work with them. Develop a strategy on informed metrics so that you can leverage higher levels of funding. Use municipal assets to leverage those and assess what you have. Don't be afraid to share it. Bring it to the table. And then set goals and track progress to build momentum. If you're sitting in neutral, you're not going anywhere, nothing's happening, it's hard to get momentum to go. But if you track your metrics, St. Thomas is able to say, hey, 30% reduction in 7 months, that's exciting, that builds momentum. So these are some of the things you can do. Thank you.
Thanks, Michael. And now we can welcome up the folks from Peel Region. We've got Sarah, Rhea, and Michael. Daniel, sorry.
Hi, good afternoon, everyone. So my name is Rhea, and I'm here today to share some of our work using data-driven prioritization methods to support the launch of the needs-based subsidies. What we plan to go through is just to provide an overview of the needs-based portable subsidies that are happening in Peel Region. Also discuss the model, the prioritization of clients, and our case conference sessions, a review of data, some takeaways for you and outcomes to date, and also a bit on our core housing need model. So why needs-based? Well, part of Peel's 10-year housing and homelessness plan, one of the strategy pillars that we're focusing on is to transform our service. And we're taking a look at what services we deliver and also how we deliver those services to our clients. And that is really what the needs-based approach is about. So we're focusing on our clients with the most urgent needs as our priority, rather than looking at chronological or program-based supports. And that has helped us to have more subsidized housing options outside of the centralized waitlist. I don't know what your numbers are like, but for Peel, our centralized waitlist has about 35,000 clients on it. So it's taking about 10 years for you to get into housing, and this subsidy offers you the ability to get into the private rental market much faster. So it's improved our ability for clients to get into and keep housing in the private market, as well as address and alleviate the housing issues before they escalate to a crisis. And that helps to ease some of the growing pressures on our emergency shelters. So some key points of the needs-based portable subsidy. One of the main things is that it's portable. So it's not attached to a specific rental address in the region, which gives our clients the flexibility to move around within Peel, so they can find housing anywhere within Brampton, Mississauga, or Caledon. And once they're approved for the subsidy, they're not locked into that housing unit, so they have the freedom to move around to something that better suits their needs. They've also have to agree to come off of the centralized wait list once the subsidy is in pay. And the subsidy, they're responsible for paying a portion of the total monthly rent. So for someone who's on social assistance, whether it be Ontario Works or the Ontario Disability Support Program, they would be responsible for paying the maximum shelter amount for either Ontario Works or Ontario Disability as their portion of the rent, and we cover the difference up to a maximum amount. So in most cases, we prefer to pay it directly to the landlord. As you know, when you're working with a very vulnerable population, they tend to find other means or other needs that the money could be applied to. So to ease landlords' fear of renting to our clients, we can guarantee that we will pay the subsidy directly to the landlord. There have been a few cases where we pay it to the clients, though, because for some reason, maybe the landlord doesn't want to participate in the program, or the client doesn't want the landlord to know that they're in receipt of the subsidy. So we will pay it to the clients in those cases, but we have clearly explained to them that this subsidy would count as income and it could affect their eligibility for other government benefits. So things like your baby bonus, your ability to sign your kids up for a jump start, which is sports programs that they can get into that subsidize. And also, for clients who need supports after moving in, they're connected with one of our regional housing support workers who can help them get settled in. And we found this to be really useful for clients who have experienced chronic homelessness, because being in a secured space is something that they need time to settle into, and that's what the housing support workers assist them in doing. So this is a look at the subsidy amounts that we provide based on bedroom sizes. You'll see that the amounts increase as you go from 1 bedroom to 3 bedroom. Caps at 3 bedrooms, and the reason for that is we followed the CMHC guidelines for their AMR amounts. So the amount $3,072 for the 3 bedroom applies for anything over 3 bedrooms as well. We also chose to use 150% AMR because you're quite aware of what it's like renting in this housing market. So the 150% allows us to be much closer to the true private market rent these days. So this is a look at some of our eligibility criteria. So when staff are determining if a client will be approved for the subsidy, these are the list of things that they will go through. When you look at the status, you will see that it's only available to Canadian citizens or landed immigrants such as permanent residents. When we started in August of last year, it was available to asylum claimants. However, they've been streamlined into their own homeless system for the region of Peel that better focuses on their needs. So now we're just offering to Canadian citizens and landed immigrants. And I will pass it over to Sarah now.
Hi everyone, I'm excited to talk about this stream that was launched in August 2023. And in this stream, our focus is on using the by name list to provide needs-based portable subsidies for Peel residents who are experiencing homelessness. Our by name list is made up of referrals from access points including street outreach, emergency shelters, housing services, drop-in centers, and other programs. When we started this project, we had 928 active households on the by name list, and as of October 23rd, we're sitting at 895 households. One of our biggest achievements has been our ability to offer needs-based portable subsidies on such a large scale and move away from the traditional chronological wait list. For some context, there are currently 35,000 people on our subsidized housing wait list, and the average wait time is 9 to 20 years, depending on the bedroom size required, and the more bedrooms, the longer the wait time. The needs-based portable subsidies have been very impactful, especially considering the systemic barriers that lead to homelessness and make it difficult for people to secure and keep housing. Using this prioritization methodology to sort households on the by name list ensures that clients experiencing homelessness are matched with resources consistently and transparently. Peel's prioritization criteria include chronic homelessness, youth, seniors, unsheltered individuals, those in emergency shelters, and individuals at imminent risk, along with various health vulnerabilities. Peel sorts households on the by name list for housing opportunities based on information collected during triage and assessment, and clients meeting more criteria will rank higher, while the date added to the by name list serves as a tiebreaker. We have allocated 160 subsidies for this stream, and we began with the pilot that tested new policies and procedures with diverse client groups, including those experiencing street homelessness, in emergency shelters, youth, and clients supported by internal and external housing support workers. And the pilot revealed several key themes. The first one being documentation. So we found that many clients lacked IDs due to their circumstances, so we developed strategies to help them retrieve necessary documents, and this included developing templates for them to send quick requests to Ontario Works, as well as the Ontario Disability Support Program. Next, we have timelines. We set deadlines to help clients and staff stay on track with communications, document submissions, and securing rental units. And while timelines were flexible, we found that many clients still required a lot of extra time to complete each step. Third, we have housing availability. So despite having a subsidy, clients face challenges in a competitive rental market. And while affordability was no longer the primary issue, we found that many still struggled to find suitable units and landlords willing to rent, and this required significant support from their case managers. And fourth, we have creativity. So innovative solutions were essential, such as exploring the use of subsidies in private group homes or shared living arrangements with friends. And lastly, collaboration, partnering and working with community providers. For example, we had our Ontario Works caseworkers participating in our case conferences to facilitate payments and access benefits for clients settling into new homes, which expedited the process. After the pilot, we rolled out the subsidies in a phased approach with Wave 1 and Wave 2, and we assigned prioritized clients to their referring organizations to the by name list for support. In Wave 3, we transferred all responsibilities to contracted intensive case managers who could also provide ongoing assistance once clients became housed. This is an overview of the needs-based portable subsidy process. This first step involves upper management determining the funding available for needs-based portable subsidies, and that helps to determine the number of subsidies that could be allocated for this stream. Step 2 is where we would notify service providers and by name list access points about the needs-based opportunities and also ensure that clients who should no longer be on the by name list have been inactivated. Step 3, staff then contact prioritized and selected clients to confirm their eligibility verbally and coordinate next steps to obtain their documents. Step 4, staff would then work with the client to collect necessary documentation to meet the portable subsidy eligibility. And step 5 is where, once eligibility has been confirmed, staff then assists clients in seeking rental units. We posted information about the needs-based portable subsidies on the Region of Peel website to reassure landlords and address any concerns that they may have. Step 6 involves the client signing an agreement to receive the subsidy and for them to provide us with information about their rental unit and their landlord. Step 7, automatic monthly subsidy payments are set up in our system, and direct payments to landlords for clients receiving social assistance are recommended. Welcome baskets and rent spark workshops are also provided to support new tenants. And step 8, clients have the option to receive ongoing case management support to maintain their stable housing. Pass it back to Ria.
So as part of the pilot, in order to communicate and better collaborate with our internal housing support working staff, as well as the external case managers at the agencies, we developed case conference sessions. So these sessions allowed us to interact more with the staff, figure out what's working well for the process, and what are some areas that we need to improve on as we're working through issuing the subsidies to clients. And it also helped us to discuss how the clients feel as they're going through this process and having to gather all of the documents. So this is a tracker of how we kept track of the first 12 clients that were involved in the pilot last year, August. So you'll see that there is a bit more than 12 clients listed there. And the reason for that is we weren't always able to get in contact with someone who had been pre-selected for the subsidy. So if we weren't able to get a hold of you, then what we did is we went back to Sarah with the by name list, and she did the prioritization matrix and selected someone else in place of that client. And those are the scenarios where you see they end with C and D. So for the clients that we were able to contact, they've all since moved into their new homes and have settled in, with the exception of one who had a medical issue. So housing had to take a bit of a backseat while they worked through that medical concern. We've since reconnected with them earlier this month, and the housing support workers are helping that person in doing the housing search right now and going to rental viewings. So from the chart, you'll see that the clients experienced many emotions as they moved through the process, starting with being told that they'd been selected for the subsidy. There were feelings of happiness, but there was also feelings of guilt, surprisingly, because they wondered why they had been selected instead of someone else. So working through from that along to being frustrated by doing the housing search. It's not easy to look for a new place to move into, even if you have the money available. There was some hesitation with landlords, so there was a bit of frustration on that end. But then once they secured housing, everybody had a smiley face. So they were all happy to know that they had homes to move into. So, Sarah.
Tracking our progress, I'm now going to share some data and outcomes from the needs-based portable subsidies. So there were a total of 478 clients that were prioritized and selected from the by name list. And out of the 478, 175 have been confirmed as eligible. Not all clients were successful due to several factors, including difficulty in reaching the client despite multiple attempts, loss of contact, the client's desire to remain on the centralized waitlist, or complete disengagement from the process. 135 clients have secured housing since implementation on August 8th, 2023, which means we're only 25 move-ins away from meeting the allocation target of housing 160 people from the by name list. Clients who are currently still in the housing search stage are working closely with housing support workers to secure rental units. Now we're going to share some takeaways and findings. So the needs-based portable subsidies emphasize the importance of maintaining real-time and up-to-date by name list information and the need for access points to inactivate clients who are no longer homeless. Prioritizing and selecting clients who should have been removed from the by name list led to slowdowns and bottlenecks, and this delayed our ability to offer subsidy to eligible clients. As well, unsheltered clients were more difficult to locate and assist in progressing through the process due to their transient nature and lack of a fixed address. And in contrast, clients in emergency shelters generally progressed through the process quicker, as staff could readily reach them at the shelter to support them through the various steps.
And some of the takeaways and findings that we found with the process itself were that when you're working with a vulnerable population who tends to be transient, as Sarah mentioned, it's very difficult to get a hold of them, but then it's also difficult to get ID from them. For the most part, they've lost IDs along the way, and we needed the documentation for this process to secure housing. So it has helped us to improve our collaboration with other agencies and ID clinics in order to get copies of available ID that they have on their system, as well as also get the client started on the process of reapplying for new ID. As someone mentioned in one of the previous presentations, housing availability is very tight right now with the current market that we're in. So having the money took care of one problem, but then there weren't suitable units, or there was a pressure of landlords being hesitant to rent to our clients as well. So some of our outcomes to date are that we've streamlined the process. How we thought it would work in our heads and how it actually works in reality aren't one and the same. So we've had to streamline and make some changes along the way to better make the process work for our clients and our staff. We've improved collaboration with other departments and community services such as social assistance. So we've created templates to help the process move quicker, getting ID and confirmation of income from Ontario Works. We've also built a collaboration with Regeneration Clinic for replacing IDs. And we've used the knowledge that we got from the homeless stream of the subsidy in order to launch the needs-based prevention subsidy, which we implemented in July of this year. So just a quick overview of the needs-based prevention stream is that the prevention stream is to assist households who are precariously housed. So this applies to anyone who does not meet one or more of adequacy, suitability, and or affordability, and who spends more than 30% of their gross income on housing costs. And I know you're thinking, that's probably everyone in this room. My housing takes more than 30% of my income. So it's to help someone in that situation. But our goal with the prevention stream is to assist 266 households by the end of December of this year by providing them with subsidies depending on their household size and the occupancy standards. To date, we've had 20 households that are in receipt of the prevention subsidy. So 246 more to go within the next couple of months, and we're destined to get it done. And there are some variables that we focus on with the core housing need data model, and I'm going to pass that over to Daniel, who will walk us through those.
Hello, can you hear me? Mm-hmm. Good. How much time do I have, roughly? Okay, good. How do we decide who is selected for a subsidy? We have to automate the decision-making process in our situation because we have 35,000 people on our wait list. Ideally, we wouldn't have to. An algorithmic approach, if you can avoid it, I would recommend avoiding it, because no algorithm, no model can ever get to know clients on a wait list as well as a person. but we don't have the resources to be able to do that. If you are interested in using data and you have similar problems, I would really recommend a paper called Against Predictive Optimization by Wang to check out. It's it's a very good paper and useful for this sort of application. Now, there's many difficulties that we've encountered in trying to develop a model that will appropriately and fairly prioritize households. And a lot of my time has been dedicated towards listing all the ways in which the model that we can build diverges from an ideal model. And I spent a lot of time agonizing over these issues, and it was useful for me to sort of zoom out and think about principles that our allocation process should possess, and then be able to take different methods of selection and evaluate them in light of these principles. So I'll just quickly walk through them. They're pretty apparent. First is transparency. We want to be able to explain why household A was selected and household B was not. It needs to be uniform so that we treat if two households are exactly the same, we would want our system to treat them exactly the same. We want it to be equitable so that people in more need have a higher prioritization. There's a bit of, the first 2 points are obvious. Equitability, there's a bit of subjectivity involved. I'll get into how we are approaching that. And then the final point is that our process should be in some way empirical. This builds on the equitability, right? If we're going to say something is more or less equitable, how can we show that? So here's some potential ways you could select people. You could draw names out of a hat. You could use our previous model for just chronological selection. You could have a completely qualitative approach, or you could have a quantitative approach, which is what we're employing in this particular case. Now, for a quantitative approach, you need some sort of score in order to be able to compare households. And I should state here that this is a pilot as well. We're figuring out, what our limitations are as an organization and whether we can turn this into something that is used on an ongoing basis beyond this current tranche of subsidies. So, first of all, can it be done? Internally, we call them housing stress scores. And the ideal is that you would identify factors that are predictive of being in core housing need and apply those findings to our population on the wait list, right? We use census data to quantify these effects, and then we give each household a probability of being in core housing need. And then we can compare households based on their probability of being in core housing need. Technically, we use this thing called logistic regression. It's statistics. It's not AI, I wouldn't call it. It's just statistics. So this is the ideal. And you'll see that this sort of diverges from what we can achieve. Firstly, core housing need is only applied to people in private households. So in trying to prevent homelessness, we don't actually observe that in the census. we don't have like the adequate data. We're making the assumption that core housing need will become so acute that eventually they will cease to be a household. So this is an assumption that we make. Okay, where to find the appropriate data? So we use census data. In particular, we use public use microdata files. There's two different types of files that we've used, we've used 2021 and 2026 census data. We use both 2021 and 2026 data because of the COVID benefits, which really threw a wrench in how, in the relationship between the variables that we're looking at and the probability of being in core housing need. And I'll go through the technical details very quickly, and you can ask me about them later. There's individual or hierarchical pumps, as we call them. We've used the individual ones because they're larger and better for our needs. And then we have to focus on variables that are routinely collected, that we collect, and that are present in the census. Okay. So before we apply our model, we want to have some reasonable expectations of what our model should do. If we're getting findings that conflict with what our expectations are, we just won't accept them. So obviously, for instance, I'll just run through these quickly. We want a negative association with income and the probability of being in core housing need. Housing the burden, the chance of being in core housing need increases with the number of children that you might have. Household burden increases with the total number of members if you hold income constant. And also the model should be indifferent to which household members is the applicant. So with that in mind, we fit the model. And this is, these are a bunch of scores. I won't go into them. Basically, every household is associated with a score. That every variable is associated with a score, and then we just add up all the scores, and then everybody's scores at the end of the day are their ranking. So implementation and complications. So certain variables we left out because they contradicted our expectations. We used a lot of judgment. We're not letting the model tell us that something that doesn't make sense should make sense. So for instance, we left out shelter costs because they went in the wrong direction for statistical reasons I can talk about. We didn't actually use household income. We used individual income as a proxy for household income, which would be a problem. In our case, we only ended up targeting people with single incomes, so it was not a problem. But there are technical reasons for that as well. We did extensive model testing in a population subset, testing out different model specifications. What we found is that basically the people at the top of the list and at the bottom of the list were very constant. Okay, and the changes only really influence the people in the middle of the list. So one of the reasons we had confidence that we could roll this out is that it would only apply to the people at the very top. And so the sensitivity to the model specification wasn't going to be as important. Okay, so we implemented the model in Power BI. It's simple to do. You can ask me more about that. And also, when we expanded this model to 35,000 households, because of the way it works, we ended up ranking single-parent households with children quite highly. And if we stuck to that ranking, we would not have got to anybody else. So we made the business decision to stratify our population and then use our rankings within those populations to select. Okay, so just very quickly, I will say that we're using the model to complement our qualitative judgments. An important point that I want to make is that logistic regression provides transparency. If you use something fancy like AI or machine learning, don't, because you can't associate an individual attribute with a score, which is what you want to do. A lot of data issues, I can go into them later, and the pilot that is showing, is showing how data can be used to assist in targeting. So yeah, that is all I have to say for now. Contact you. Okay.
Thank you so much for that presentation. And now we'll just do a bit of a Q&A. We have a very helpful volunteer at the back who has a mobile microphone. We've got a question up front here.
Just testing, yep.
She's going to come around with the microphone so that the recording can catch it.
So I have a question for the very first panelist. So for you, actually, I'm sorry I missed your name. You have the yellow sweater. The very last sentence of your presentation I thought was really inspiring. Do you think you could repeat it for me, please? I'd like to take it in my notes. You said something about creating an environment. If you could just... It's the very last sentence of your presentation. If you have it, I'd love to. And then my second question would be for Michael, I believe. You said something about the importance of engaging with municipality staff. Do you have any tips on how to positively engage with municipal governmental staff? Please.
Yeah, good question. This is very convenient because you're sitting next to me. I mean, I would, my short pass-off answer would be to speak to many of the folks here who are working in municipalities, and they would be able to tell you the best way to get in touch with them. I think the best place to start is to get involved in your local community with the organizations, the grassroots organizations who are doing the work. Those folks in their leadership structure typically have channels through which they communicate with their local staff and leaders. That's often a good way to go. Especially because then you have the legitimacy of working through a relationship that already exists, if as opposed to being, someone who, you're just sending a letter into your MPP, they don't know who you are. But if you're saying, hey, I work with, or I volunteer with YWCA, I was speaking with our director, and here's an issue that they've been noticing that I've been noticing, can we talk about how to solve it? So that'd be my recommendation.
Thank you so much for saying that. That's really, really sweet. I appreciate your what you said about my last line because I wrote it this morning. So that's why I couldn't remember what I said, but I do appreciate it. What I said was we can't end homelessness in silos. We need to be working together to tackle it, and by using the principles we know from the Housing First philosophy, creating an environment that facilitates recovery, multi-level coordination, and partnerships, we can move closer to seeing the end of homelessness in Canada together. And just so you know, this session was recorded too. So if there's any other words that I said today that was awesome, you guys can all go back and listen to them again. I encourage you to do that.
Hi, I have a question for the LOFT team. Can you just explain a little bit more about how you're integrated or not integrated in the coordinated access system. I think I was a bit because you're not receiving referrals from the coordinated access system, or you are?
So the shelters are receiving referrals from the coordinated access system for housing. So and like coordinated access system is like a huge, it's multi, it means lots of different things, right? So I think specifically what we're looking at is the housing piece, and getting people out of the shelter system into housing. So how are we getting people ready to go into housing from the shelter? And a lot of times, just the crux of what we were saying is that the coordinated access system works really well for a lot of people, but and just by what we were hearing earlier, it's not a perfect system. And so when people's names come up and they're not always ready for housing for different reasons. And so we're doing our very best to try and focus on the people that need that extra level of support that the shelter staff can't provide. So we're there to get them ready for when their names do come up.
Just a question for the folks from Peel. First and foremost, I think that's a brilliant program. Kind of a three-parter. Is the intent of the program to supplement or replace the COB program? And then I guess with noting the percentage of AMRs that you're using, making it a lot easier for folks to obtain housing, has the receptiveness to this program been higher than the COB program for clients? And what is the length of the program?
So I'm going to start with your last question first. So right now there is no end date for the subsidy. Once you're approved for it, you will continue to be eligible for that subsidy more than likely unless you income out from it. So every year we will do an annual review to look at your income, your finances, and if you are above the eligibility amount, then more than likely that's the only way that you would stop receiving the subsidy. Or if you chose to move outside of Peel region, you would also lose the subsidy for that as well. In terms of COB, we also do have COB funding as well. So in some cases, we've had clients who have had to choose whether they want to receive this portable subsidy or they want to receive COB because they can use COB within the province. So it's not really taking away from COB, but we're providing more options to clients in terms of what they can do for their housing situation. And the 150% AMR definitely makes it easier to get into the private rental market because it better matches the rents that landlords are asking at this time.
I just wanted to add, and because for Peel, we give a letter, so it helps clients get out.
Can you just wait for this to...
Oh, I was just answering. Oh.
Our needs-based portable subsidy program helps a little bit more for the homeless to get housed because we provide documentation to show that they have it, whereas COHB or homeless had more of a struggle because they couldn't prove they were getting it.
Hi, George Mitchell, chronic homeless person with cancer. Also, person who's invested 25,000 unpaid hours to become a bit of a unicorn expert. To Peel, 266 over 35,000. Is that the appropriate percentage of who you're going to be helping?
So 266 prevention subsidies are for people who are currently housed. So that doesn't apply to the people, the 35,000 that are on the centralized wait list in all situations, because there are some homeless people who are on the centralized wait list waiting to get into a subsidized unit. So those would be different categories.
Okay, as a person who has been on homeless wait lists across the province and who hitchhikes, planes, trains, automobiles to go to conferences across the country, my contact method has been by mail. How long do you give people when they're trying to connect with you by mail to get back to you? Because in Peterborough, I fell off a wait list because my response time needed to be a week. And sorry, I'm not at my post office box and am able to give an immediate response to a letter. So the policies and procedures are chronically problematic, which comes back to how many homeless people, how many people of expertise do you have on the list? Because where I'm coming from is, came to the conference in 2017, home ownership that ends homelessness was part of the concept that I was looking at, an engagement economy. And that came about because I didn't have development environment back in Peterborough, which for 14 years I'm saying need development space. And my development reality has gone from living at the shelter to living in an unheated bus shelter. That's not equitable at a point of where I'm going, I appreciate the enthusiasm that's expressed with these models and the various presentations, and yet I have a sense of something that is far, far better, and I'm dying of cancer on the street. So, I guess the question is, how do you engage and empower homeless experts to be contributing and compensate them for their intellectual property? Tim and crew have said they're having trouble with that how, and acknowledging that has been the most inspirational moment of this conference, of saying we don't know how to do it, and that's for a national organization. So any response to how you do it for the local levels here?
So for Peel, one of the ways that we maintain contact or attempt to get into contact with our homeless and most vulnerable population is we attempt to do it through the shelters. So working with the housing support workers, the shelter case managers who know the locations that their clients frequent the most, they will go there to physically try to find the person and make contact with them to let them know about their potential eligibility for the subsidy. We are following a procedure right now where we're doing 3 attempts within 5 business days, but that's been extended because we've realized that it's difficult to get a hold of someone within that short of a timeline. So we've had the case managers push back and say, we need more time to get in contact with people, and we've been flexible around timelines and getting contact because we want you to find housing. We realize it's going to get very cold very soon. We want to help you get into secured homes. So we have a timeline that we would ideally like to work with, but we understand that that's not what's going to happen in reality. So we are flexible with making contact, the timelines that we have to do that, and offering subsidy to those who are most in need. And if you come back, let's say in 3 months or 4 months, because you just found out through your mail that you were eligible for the subsidy, we're still able within that time to offer it to you and help you start doing the housing search.
That part is encouraging. The comment I was going to make as privileged homeless person, I'm typically couch surfing, and I'm not connected to hardly any of those types of services.
Okay. Thank you for sharing.
Hi, my question is for the first 2 groups. My name is Betty, I'm from Winnipeg, Manitoba. So I've been around since at-home Chez Soi days, and I congratulate you all for this, the work you're doing. My question though is, when we talk about partnerships, I think in that you have to have a partnership with the people who are going to be impacted by any work you're doing. So I guess I'm trying to find out, because I'm always interested in when people say people don't want to engage. The reasoning behind that, being a former homeless person myself, has heard so many promises, not interested anymore, right? So how do you build relationships to go beyond that and acknowledge that it's up to us as the workers to build the relationship? And then around housing, I remember I was at Thunderbird House and someone from one of the shelters in Winnipeg said something, and he went up in front of everyone. We were talking about houselessness and housing, and he said, "Stop doing this to us. Stop taking us from a shelter and putting us in a place all by ourselves. Allow us to choose when we want to go. Like, we're living in a shelter, we could have been there for years. So give us, like, maybe 2 of us want to live together, 3 or 4. So when housing is being built, how are the voices of the people who are going to be impacted by anything that is built? Where are their voices so what is being built will meet the needs that the people want? Thank you.
For the first question, I absolutely agree. I think our motto tries to be persistence and consistency, and really meeting folks where they're at, understanding that, you know, a lot of folks have been in the system, and you're right, they're not ready to trust another person. So just continuing to go back and keep it as, you know, casual, so to speak, as possible. Let's have a coffee. Let's just chat. I think our model's flexible to be able to stand the test of time, where we can continue to go back and ensure that those relationships are built on trust and actionable items like, okay, tell me what you need. How are we going to do it? How can we support you through that? But totally understanding that it takes time to build that, and that there's been a lot of trust broken over time. And I agree, we need different models of housing for each individual based on what they're into.
Thanks for sharing and asking your question. I think I have to acknowledge first off that there's a lot that I don't know and a lot I haven't experienced, and what I have to do is continually listen and learn from folks, especially those who are going to be housed in the scope of what I do. That's permanent housing. I can't speak to shelter and shelter design, but I think of some of the tenants that I've had the privilege to build relationships with, specifically at the Indwell programs, and learning from them, folks who have come from street homelessness, and in doing our best to learn and incorporate that into our designs of permanent housing. So an example that comes to mind is I had never really thought about the impact of, in your apartment, when you come out into the hallway, there being a bit of an alcove so that when you open your door, you can actually, you're not immediately in the corridor, which for some folks can be an extremely intimidating experience, to leave your room and be right in the corridor where anyone can be walking by, but to have a bit of an alcove so you could open, you could peer around the corner, you could see if anyone else is there before you exit your unit. That's something I just would never have thought of. I learned that from a tenant who came from being actively engaged in homelessness, and saying this was really important to them. And another quick example, talking about just the feeling of isolation and how much that compounds the problems. Trying to incorporate in our design wider hallways, having natural light coming down. One of our buildings, we kind of took out the middle, and all of the floors can see down to the community center of what's going on. So if you're not just going in and out of your unit like a human filing cabinet, but you can actually, as you leave your unit, the natural light comes in, you can see what your neighbors are doing. Just, again, trying to learn from people. So I think taking that posture is really important. That's all I can say.
And I do hear what you said when you mentioned that leaving the shelter and moving into a place on your own can be intimidating and very scary for our clients. So with the portable subsidy, you do have the flexibility if you'd like to live with a friend. You can look for a 2-bedroom and they pay their share of the rent, and you have the subsidy to cover your half. You also do have the ability to live with family. So you can rent a room with a family, or if they have extra space in their basement, like the subsidy will cover that. So that we are very creative in the solutions that we come up with when we approve you for the subsidy, and you have flexibility as long as you're within Brampton, Mississauga, or Caledon.
That is all the time we have today. So if you would like to continue these conversations, you can definitely connect with any of the panelists. Or if you would like to continue these conversations right now, you can head to the Lived Experience Lounge, which is on this floor. And if you need the room number, you can see me in the back when I have my booklet on me.